Dr. Nida Ali, Director of Government Affairs and Partnerships for the Coalition of Global Hepatitis Elimination. Dr. Ali works at the intersection of policy, advocacy, and global partnerships, helping to build collaborations that accelerate progress towards elimination. Her leadership in engaging stakeholders and advancing public health initiatives has been instrumental in driving meaningful change. So please join me in welcoming Dr. Nida Ali.
Thank you. It's an absolute pleasure to be here with all of you today. Since my topic is raising hepatitis on the UN agenda, I want to start with the story of a country that once had the highest hepatitis C infection rate in 2015. And today, the same country, Egypt, is the global gold standard for elimination. So this is Egypt's story, and the real lesson in the story is not about medicine. It's about what happens when political leadership decides that disease is no longer acceptable. Now, how did this crisis begin? Sort of unable to advance my slides. Yeah. So it actually happened decades ago due to mass campaign against schistosomiasis between 1950s and 80s. So when inadequately sterilized needles were used and then reused and ended up spreading hepatitis to millions. So it's a reminder that today's health interventions can quietly become health challenges of tomorrow if we don't get the basics right. And in this case, it was injection safety. So the Egyptian government launched this campaign with the name that is as bold as its ambition, the 100 million healthy lives. The objective was to screen the entire population and treat every single person that is found to be carrying the virus. And when I say the entire population, I mean this went far beyond the walls of the clinics. Testing was not just inside the hospitals. It went to markets, it went to clubs, mosques, churches, even barbershops, and in some cases, to the household. So between 2014 and 2020, Egypt screened between 50 to 60 million people. And that is almost like testing the entire population of Italy for one disease. And it didn't stop at testing. By the end of 2020, 5.5 million people had been cured, with 92% of everyone who was diagnosed as positive for carrying the virus actually getting the treatment. Now, Egypt didn't wait for the world to lower the prices of the cure. It built its own. So it started with the manufacturing infrastructure and setting the price within the country by the country. So this is the classic example of what domestic ownership looks like. So first was market shaping. Egypt authorized local manufacturing of generic cures and negotiated hard, driving the price of the full curative treatment down from $900 to under $40. So second, there was a lot of political commitment and strong domestic financing that made testing and treatment completely free for the local public. So the price drop and reduction in out-of-pocket cost from generic competition and policy, it engaged both these components because generic manufacturing needed the government's authorization and procurement muscle behind it. So the price didn't fall until Egypt negotiated it down and manufactured locally. So let's look at the progress. Egypt treatment scale up has been the single biggest factor for 28% decline in new hepatitis C infections in the Eastern Mediterranean region. Egypt's own new hepatitis C infection rate fell by 97% nationally between 2014 and 2022. So for numbers, this translates from 300 cases per 100,000 down to 9 cases per 100,000 today. And this is not just the example of good public health, it is good economics as well. I know Su Wang talked about the economic benefits. So in case of Egypt, the program is projected to become fully cost-saving by 2029. And between 2018 and 2030, it's expected to save $35 million in direct healthcare cost and generate an estimated $4.7 billion in broader economic gains. And of course, the world took notice of that. In October 2023, Egypt became the first country in the world to officially be validated by WHO as having a gold tier status on the path to elimination. This means that Egypt had met the coverage targets needed to eliminate hepatitis C incidence and mortality before 2030, the first in the world. And Egypt didn't stop at its own borders. They took the route of international diplomacy and international cooperation and provided treatment to countries across sub-Saharan Africa. Imagine a country that once had highest numbers of Hep C cases in the world, and they are now exporting cures. I know most of us are familiar with the global numbers, but I have to stress this picture here. Hepatitis B and C cause more deaths than HIV and malaria combined, two big infectious diseases that received a lot of international attention and assistance, which is why the mortality numbers are what we see here today. So why hepatitis doesn't receive that much attention and resources? We know that Hep B and C account for nearly 8 times as more prevalent infections than HIV, yet it receives less than 1/10 of global funding. So WHO estimates that to achieve the elimination targets, the investment is needed to be scaled up by $8 billion a year by 2028. So the lesson is simple. Hepatitis elimination is not a technical challenge. We already have the tools. We know we have vaccine for hepatitis B, we have treatment for Hep B, we have cure for hepatitis C, and yet globally, the mortality is still rising. We also have the proof of concept in the form of Egypt's example, and there are many other countries' examples as well. So if the tools are there, why isn't the money following? That's a big question. It's a big funding gap that nobody is watching. And what's missing is enough organized political attention and commitment. So which is precisely the gap that Group of Friends exists to close. So 4 years ago, a small group of us decided to build this attention. And before 2022, there was no dedicated political home for hepatitis at the UN. Advocacy was fragmented across sectors, and hepatitis was largely absent from the UN discussions and high-level political agendas. But no disease has ever reached elimination level through technical guidance alone. We have examples from the past. We were able to make progress for smallpox, for polio, for HIV and malaria because there was the highest level political commitment. So building such an infrastructure for hepatitis, it is we feel the need because the mortality numbers, like you saw, 1.3 million people dying every single year, that is comparable to TB, and of course way off as compared to HIV and malaria. So the Group of Friends to Eliminate Hepatitis is an informal coalition of member states at the UN, and they have one mission: to elevate hepatitis on the global political agenda. So it started with one country's invitation. This is the letter that was sent out by the permanent representative of Egypt to the UN, Ambassador Osama Abdul Khalik, and he invited all the UN missions to join the cause. And this wasn't just a big guest list, it translated into real influence. As you can see in these pictures here, the picture on the left is from 2022. There were 12 member states at that point, and at 2025 annual meeting of the Group of Friends, we had 63 member states overall that have participated in Group of Friends over the years. So from 12 countries to 63 now, we successfully managed to send the message across. So hepatitis is now part of the broader UN discussions. Liver cancer prevention through Hep B and C elimination has been folded into NCD advocacy. It was part of the political declaration on non-communicable diseases. We have engaged 63 member states, sorry. We secured a ministerial statement, and we laid the foundation for future high-level meeting at the UN, bringing this advocacy, technical aspects from Geneva and political aspects from New York. But let's be honest about what the underlying epidemiology and the latest numbers tell us. So WHO released their global report on hepatitis in 2026 this year, and it shows that despite some progress, we are still off track on elimination. So this 2026 scorecard is a humbling reminder that we are still way off on achieving the target of elimination. Hepatitis B related mortality has increased by 17% since 2015, and diagnosis and treatment gaps still remain severe. Most people living with either Hep B or Hep C still don't know their status. And birth dose vaccination has stalled at 45% globally and just 17% in the African region, which carries the highest burden of new infections. So the gaps are wide, and I think they deserve urgent attention, urgent global attention. So what do we need beyond 2030? Evidence alone does not move member states. We have all these scientific advancements that we can have, but politics, priorities, and pressure is also very important to garner that kind of attention that it deserves. And we also learned that trust takes time, and informal diplomacy is often something that matters more than formal processes. So policy windows are created and not waited for. Egypt is a shining example that the proof of concept is there, the science work. The group of friends is showing us that politics can work too. So if your mission hasn't joined yet, I'd love to talk after this session, because hepatitis elimination was never a technical challenge, it's a political one. And that means everyone here today is already a part of the solution. So thank you.
Thank you very much for that. That is a powerful way to close out the quickfire presentation portion of our time together. And I'm thinking what amazing work it is with the group of friends as an example of a science and policy interface where we are getting the right people in the right room at the right time. And I think that partnership and collaboration is such a key element of moving this discussion forward.